Thank you for viewing this educational presentation. This module discusses female sexual dysfunction. In some cases, as women age, their sex life seems to lose its spark and their bodies become less responsive, or they may feel as though they just aren't interested anymore. These issues are becoming a common concern for women. By some estimates, as many as 4 in 10 women have experienced some form of sexual dysfunction. Female sexual dysfunction, or FSD, is when sexual intimacy for women is not as pleasurable as it once was, or if it is not enjoyable at all. You are not alone, and fortunately, it is a treatable condition. Female sexual dysfunction can be organized into 4 categories, ranging from lack of sex drive to sexual pain. These include low sexual desire, sexual arousal disorder, orgasmic disorder, and sexual pain disorder. Low sexual desire simply means a decrease in libido, a common term used to describe sexual desire or sex drive. In those with sexual arousal disorder, the desire for sex may be intact, but there is an inability to become or maintain arousal during sexual activity. Orgasmic disorder is determined to be the cause of female sexual dysfunction when there is a persistent or recurrent difficulty in achieving orgasm, while pain associated with sexual stimulation or vaginal contact is deemed to be sexual pain disorder. In women, most of these sexual problems can overlap in more than one category. The symptoms of female sexual dysfunction are closely related to the 4 categories discussed on the previous slide. Symptoms include decreased desire to have sex or complete absence of that desire, difficulty maintaining arousal during sexual activity or lack of arousal despite a desire to have sex, inability to achieve orgasm, and pain associated with sexual contact. What are the causes of female sexual dysfunction? There are several factors that can contribute to sexual dissatisfaction and dysfunction, and these causes tend to be interrelated. Female sexual dysfunction can be caused by physical conditions, hormonal changes, and psychological and social issues. There are a number of physical conditions that may cause or contribute to sexual problems. These include arthritis, urinary or bowel difficulties, pelvic surgery, fatigue, headaches, other pain problems, and neurological disorders such as multiple sclerosis. Also, there are certain medications, including some antidepressants, blood pressure medications, antihistamines, and chemotherapy drugs that have been known to decrease sex drive and the ability to achieve orgasm. Female sexual dysfunction can also arise from changes in hormones, which are chemicals that are released and affect other parts of the body. Changes in estrogen levels, for example, during menopausal transition, may lead to changes in genital tissues and sexual responsiveness. In this case, the folds of the skin that cover the genital region, the labia, shrink and become thinner, exposing more of the clitoris. This increased exposure sometimes reduces the sensitivity of the clitoris or may cause an unpleasant tingling or prickling sensation. Additionally, thinning and decreased elasticity of its lining causes the vagina to become more narrow. This is particularly true of women who are not sexually active. Many of these factors may lead to uncomfortable or painful intercourse, known as dyspareunia. Any change associated with estrogen levels during menopause may impact sexual function. However, most women continue to have satisfying sexual intimacy. Psychological factors that cause or contribute to sexual problems include emotional difficulties such as untreated anxiety, depression or stress, and a history of sexual abuse. During pregnancy, after childbirth, or while breastfeeding, you may experience a decrease in sexual drive. You may find it difficult to fill multiple needs and roles, such as job demands, homemaking, being a mother, and sometimes also caring for aging parents. Your partner's age and health, your feelings towards your partner, and your view of your own body or that of your partner are additional factors that may combine to cause sexual problems. Cultural and religious issues also may be contributing factors. Psychological factors may contribute to or result from sexual dysfunction. Regardless of the cause of sexual dysfunction, you usually need to address emotional and relationship issues further for treatment to be effective. Although many women are reluctant to discuss sexual concerns with a physician, it should be noted that sexual well-being is an integral part of a woman's life. Physicians may ask about the sexual health of a woman during routine visits, but women should attempt to be as forthcoming as possible about any problem they may be experiencing. In order to test for female sexual dysfunction, a pelvic examination may be necessary. The physician will check the pelvic region or any abnormalities or physical changes that may be affecting sexual enjoyment. The physician may also refer you to a counselor or therapist to help assist in advising you about sexual relationships. There are two forms of treatment for female sexual dysfunction: non-medical treatment and medical treatment. In reference to non-medical treatment, many factors can be addressed. Communication with your partner is essential, as open and honest communication with your partner can enhance your emotional and sexual intimacy. There are a number of couples that never talk about their sex life, while others are less inhibited. It can be difficult to resolve differences in sexual desire with your partner over a lifetime, and communicating your feelings may be helpful. There are good books available to help you better communicate with your partner about sexual likes and dislikes and ways to provide feedback in order to fulfill your sexual needs. Ask your doctor for recommendations. Also, begin to make smart, healthy lifestyle changes. This would include avoiding drinking excessive amounts of alcohol, quitting smoking, exercising regularly, and making time for leisure and relaxation. Not only are all of these important for your sexual health, but they are also good for your overall health. It is also helpful to strengthen your pelvic muscles. Pelvic floor exercises can help with some arousal and orgasm problems. Doing so-called Kegel exercises strengthens the muscles involved in pleasurable sexual sensations. To perform these exercises, tighten your pelvic muscles as if you're stopping your stream of urine, although don't do it while voiding. Hold for a count of 5. Relax and repeat. You can perform these exercises several times a day. Your doctor may also recommend the use of vaginal weights while exercising. You may also want to seek counseling. A sex therapist or counselor who is skilled in addressing sexual concerns may be of benefit to you whether your condition is due to emotional factors or other factors. A sex therapist will typically evaluate your specific situation by asking you questions about your sexual identity, beliefs and attitudes, relationship factors including intimacy and attachment, communication and coping styles, and your overall emotional health. Therapy often involves education about sexual response and techniques, ways to enhance intimacy with your partner, and recommendations for reading materials or couples exercises. If a non-medical approach to the treatment of female sexual dysfunction is ineffective, it may be coupled with medical treatment. Effectively treating sexual dysfunction often requires addressing an underlying medical condition or hormonal change that's affecting your sexuality. Medical conditions that can contribute to sexual dysfunction include depression or anxiety, diabetes, cardiovascular and neurological diseases, pelvic or abdominal surgery, and cancers. There are a few times in a woman's life where she may be susceptible to vulnerable hormone levels, usually during pregnancy and the postpartum period, while using hormonal birth control methods, and during perimenopause and menopause. In order to treat the underlying condition, medical therapy for sexual dysfunction might include adjusting or changing medications that have sexual side effects, treating thyroid problems or other hormone conditions, optimizing treatment for depression or anxiety, strengthening pelvic floor muscles, and taking measures to relieve pelvic pain. The next step may be to treat hormonal deficiency directly with hormone therapy. Hormonal therapy can come from 3 sources: estrogen, progestin, and androgen. Let's first discuss estrogen therapy. Estrogens are important in maintaining the health of vaginal and external genital tissues. Replacing estrogen can improve sexual function in a number of ways, including increasing the tone and elasticity of vaginal tissues, increasing vaginal blood flow, enhancing lubrication, and having a positive effect on brain function and mood factors that impact sexual response. Localized estrogen therapy in the form of a vaginal cream, gel, or tablet can help with sexual changes due to menopause. The second hormone replacement treatment is progestin therapy. Some clinical studies have demonstrated that women taking progestins experienced a decrease in sexual desire and vaginal blood flow. However, in other studies, women experienced improvements in desire and arousal when they took a progestin in addition to the estrogen. Additional studies are needed to address these differences and to see if different progestin regimens, alone or in combination with estrogen and other hormonal agents, may benefit sexual function. Progestins are generally prescribed to balance the effects of estrogen on the uterus and not to treat sexual dysfunction. The third approach to treat hormone deficiency is androgen therapy. Androgen therapy, which includes male hormones such as testosterone, may be a beneficial treatment. Testosterone is important for sexual function in women as well as men, although testosterone occurs in much lower amounts in a woman. Although androgen therapy for sexual dysfunction in women is controversial, studies have shown a benefit for women who have low testosterone levels and develop sexual dysfunction. In these women, testosterone therapy reportedly improved libido, arousal, and sexual thoughts. It should be noted that other studies have demonstrated little or no benefit of testosterone therapy for women, and currently, no standard FDA-approved testosterone preparation exists for treating female sexual dysfunction. Testosterone therapy is available as a cream or gel patch applied to your skin. Sometimes testosterone is given as a pill or an injection. Possible side effects for women on testosterone therapy include acne, excess body hair or hirsutism, enlargement of the clitoris, and mood or personality changes such as aggressiveness or hostility. Since the long-term effects of androgen therapy are unknown, you should be closely monitored by your doctor. Emerging alternative treatments for female sexual dysfunction are on the horizon. Currently, researchers are evaluating the effectiveness of drugs such as sildenafil or Viagra, tadalafil or Cialis, and other drugs approved for the treatment of erectile dysfunction in men in treating certain types of female sexual dysfunction. Most studies have shown little benefit for women, but some have reported a benefit for women with sexual dysfunction due to antidepressant or anti-anxiety medication side effects. Tibolone is a drug currently used in Europe and Australia for treatment of postmenopausal osteoporosis. In a small study, women taking the drug experienced an increase in vaginal lubrication, arousal, and sexual desire. The use of tibolone is not approved by the Food and Drug Administration, or FDA, in the United States. Female sexual dysfunction, or FSD, is a common condition in women. It is actually even more common than erectile dysfunction in men. FSD can be caused by a number of different factors and conditions. However, FSD is a treatable condition with both non-medical and medical treatment approaches readily available. If you are suffering from FSD, please consult your doctor. These current references were used to assist in the preparation of this module. All of these are available through your local medical library or the internet if you are interested in more detailed reading on this subject. Thank you again for viewing this educational program. See your doctor if you would like to discuss this subject further. Dysfunction are closely related to the 4 categories discussed on the previous slide. Symptoms include decreased desire to have sex or complete absence of that desire, difficulty maintaining arousal during sexual activity or lack of arousal despite a desire to have sex, inability to achieve orgasm, and pain associated with sexual contact. What are the causes of female sexual dysfunction? There are several can be organized into 4 categories ranging from lack of sex drive to sexual pain. These include low sexual desire, sexual arousal disorder, orgasmic disorder, and sexual pain disorder. Low sexual desire simply means a decrease in libido, a common term used to describe sexual desire or sex drive. In those with sexual arousal disorder, the desire for sex may be intact. These issues are becoming a common concern for women. By some estimates, as many as 4 in 10 women have experienced some form of sexual dysfunction. Female sexual dysfunction, or FSD, is when sexual intimacy for women is not as pleasurable as it once was, or if it is not enjoyable at all. You are not alone, and fortunately, it is a treatable condition. Female sexual dysfunction, but there is an inability to become or maintain arousal during sexual activity. Orgasmic disorder is determined to be the cause of female sexual dysfunction when there is a persistent or recurrent difficulty in achieving orgasm. while pain associated with sexual stimulation or vaginal contact is deemed to be sexual pain disorder. In women, most of these sexual problems can overlap in more than one category. The symptoms of female sexual Thank you for viewing this educational presentation. This module discusses female sexual dysfunction. In some cases, as women age, their sex life seems to lose its spark and their bodies become less responsive, or they may feel as though they just aren't interested anymore.